Dealing with cancer and your treatment can leave your body very tired. It's normal to feel this way, and it's often a common side effect. Plan your day ahead carefully, as you may find it becomes harder to do those things that previously you took for granted. Make time for the small things and prioritize everything else, while making sure you take regular breaks. Develop gentle exercise and relaxation techniques, as these will help movement and alleviate breathing restriction. And above all, don't be afraid to ask for help.
I felt tired and I'd done nothing. And that's the worst thing, you know. You can get out of bed and being asleep, you know, and within half an hour, an hour, you were tired again.
And you just wanted to curl up in a ball and hibernate.
Mm-hmm.
That was one of the hardest again. That was like the beginning, when it just became totally focused on getting through it. So there was no room for anything else, no room for pleasantries, anything. Couldn't do any of that. It was just because you were so tired and so exhausted.
So you learn to take things in your stride, you know. If I want an early night, I'll have an early night. If I want to have a slightly later night, I'll know.
I use meditation. I have done for quite a long time. I just close my eyes and I do repeat a mantra. It's got 4 syllables. And it's breathing in for Ma Ran and then Arthur. It's 4, 2 in and 2 out. And close my eyes, and it can be anything from a few minutes to perhaps 20 minutes.
I have this sort of private exercise that I do. I'll have my bath and it'll be quite deep. I'll lie there and I'll do really deep breaths and my body just floats up. Then I exhale and down I come.
Dog walking is very useful exercise-wise because, dogs are loving and warm animals. They don't understand that you're ill. They will want to go for a walk every morning. So it's a discipline thing. Even if you don't feel like taking exercise that day, you have a responsibility to that animal, and you will take him out, and you will get your exercise.
Gardening is a good exercise because, again, you're outside in the fresh air, you're bending, you're stretching, you're enjoying. You can either put little seeds in pots and then transplant them on, but there's a progression. And with a bit of luck, if you don't overwater them, you know, you're going to have flowers or you're going to have shrubs.
Going up the stairs and things like that, you know. I know it's hard for a lot of people at first, and that, but you can manage how you control it yourself. You know, if you only have to go up 1 stairs or 2 stairs at a time, you know, that's fine. You can sit down on the stairs if you're out of breath, you know, rather than be stood up and doing exercise and then keeling over, you know, on one thing and another.
The physio came to see me and they suggested, I think they suggested breathing.
And some exercises to mobilise that part of the body, because
Yes.
it was on the left-hand side, the wound. And obviously, if the movement didn't occur regularly, we get some stiffness and that limitation of movement on that side. So you had a little bit of physiotherapy, and I gave you a tip. We're using a soft scarf just to mobilise as well. So you could do that, very gentle exercises.
Yes.
It was just a range of to keep everything going by passing the scarf around, and obviously as the range increased, you could actually move your hand along the scarf a little bit further, but you'd have to be guided by the physio who was treating you. But that's a very nice, gentle mobiliser.